Hey everyone, this is Dr. Aruna from Trinergy Health, and this is another video testimonial of a person that I had the pleasure of working with recently, who went through my program, Psychiatry 2.0. It's a 6-month program, and I like to do this to give you all a realistic idea as to how easy it is to heal from chronic mental and physical health conditions. And so I'd like to introduce Pat, who is my patient's husband. And Pat is here. He's very kindly agreed to give us his perspective about his wife's journey before, during, and where they are right now. And so, Pat, thank you so much for doing this. So let's start by talking about your wife's health conditions.
Well, when we came to you, they were in need of help by far. It was a very difficult time for our family, and the process has been remarkable. I think at the very beginning, when you start something, sometimes it's overwhelming.
Yes.
It feels overwhelming, but you do a little bit at a time, and you take that on and you make it better. And with the understanding that if I do this, I know that an outcome will be something I'll be happy with, and I think we've reached that. So I think we're excited about that.
Thank you so much. But let's talk about your wife's health conditions and the diagnosis that she had, and how long was she
Sure.
suffering from. So let's start with her physical health conditions. What were some of the things that she was diagnosed with?
Oh, I don't know exactly what she was diagnosed with physically, but she was having issues with her body. Wasn't comfortable. Exercise wasn't really helping her with losing weight or anything like that. Although she always watched what she ate, she was careful what she ate, but it wasn't helping her lose weight. I think she was conscious and more self-conscious of her belly area than she needed to be, but she couldn't reduce that at all, and she was very frustrated with that. So
So weight gain was an issue.
Yes.
And to just give people a perspective, your wife is in her early 60s.
Yes, that's correct.
Correct. And then I recall that she was also struggling with allergies and
Absolutely.
asthma was also one of the diagnoses.
Yes, absolutely. And thank you for adding that. But she has been on medication for, especially in the springtime, with like Flonase and Allegra and all those things that would help her with the springtime allergies.
Her breathing.
Because it was bad. Sometimes she would hyperventilate because it would get so bad she couldn't breathe, and it was very difficult.
And that itself can cause anxiety when you're not able to.
Absolutely, it definitely brought a level that was uncomfortable.
So physically, these were some of the things that you were noticing. There was, and I know, being her doctor, I know that she was also struggling with some thyroid hormone issues contributing to the weight gain.
Yes.
And if I remember correctly, so your wife now, she's in her early 60s, but her problem started postmenopausally. So we are really talking about the length of time that 15, 20 years she'd been struggling with this. The asthma and allergies go back even before that. I think
Absolutely.
For decades she had been on inhalers and allergy medications,
100%,
steroid inhalers. Flonase is also a steroid thing.
That's correct.
So that every spring that was the story, and it was not getting better, and she had reached this point. And for our listeners, I can share that even the mental health issues, the majority of them actually started postmenopausally.
Yes.
Before that, there were some trauma-related issues, anxiety, depression, those things were going on. But postmenopausally is when she was diagnosed with bipolar disorder.
That's correct.
Yeah, and then, so can you give us an idea how that was with her bipolar disorder? What did you experience as a family member?
It was a nightmare, honestly. I mean, the mania episodes were very difficult to deal with, and it's happened over multiple years, and if you're familiar with that type of challenge, it'll flare up for a period of time and then kind of disappear for a while.
Yeah.
And then at some point something happens again and it flares up again, and that was just very, very difficult to go through those things.
Yeah. And kind of, causing, of course, she was herself suffering, not being able
Of
to understand
course.
what was happening. And if I remember correctly, even the diagnosis was not immediately apparent with all the help that you were seeking.
Yes.
And but it really put a toll on the relationship all around. Yeah.
Well, not only just my relationship, but a relationship with everybody in the family.
Yes.
You know, I didn't know what to do. So I brought family members in to try to, if I was doing something wrong, or how we could combat this. And we were seeing psychologists and psychiatrists, and they weren't helping to the degree that we needed help, where it was more of a internal issue than it was the outcome. Obviously was external and mania and things like that, but
yeah, and unfortunately, I think in mainstream psychiatry or in mainstream medicine, it's a very piecemeal approach. I mean, for bipolar, you go to the psychiatrist.
Yes.
For asthma, you go to a respiratory physician, pulmonary physician, and and then for thyroid, you go to an endocrinologist. And each one is doing their own thing in their own silos, not really seeing that this is all one person, one human being, one mind, body, spirit system.
Well, that's exactly right.
Yeah, and what struck me was that the manic episodes were very much happening in spring.
Yes.
Spring, and that of course we do know there is an association of manic episodes with spring and depression episodes in winter, and that's called seasonal variations. But in reality, what happens is the particular insults that can happen to a person during these different times. And so my hypothesis, as I've explained, is that it's diet, trauma, and toxins,
Yes.
which lead to inflammation. And when that inflammation reaches the brain, we can see bipolar or we can see depression. It's the disease form can be varied, but the underlying processes sometimes really is about inflammation and or degeneration. And that's so for me, the fact that she was having these severe flare-ups of allergies and asthma in spring, and it was associated, and around the same time we were seeing the bipolar manic episodes, really made me realize that there was a connection between the two, that her immune system was getting flared up with all these external triggers. And then of course the treatment, which was heavily with steroids,
Yes.
that was one of the big aha moments I had, was like, oh, we know steroids can trigger manic episodes.
Yes.
That was one of the things.
Yeah, and you take the medicine to make you better, and then actually trigger something else.
Something else, yeah.
And which was a whole lot worse.
Yes, yeah. And so, I mean, of course, in my approach, I really look at the whole person, the mind, body, spirit system, all the systems. And when I intervene with any treatment, it's not only one organ system, but all organ systems have to improve. Because if inflammation is in the brain, it's also in the lungs, it's also in the gut, it's it's everywhere.
Yes.
So and that is the approach that I take. And so tell our listeners about what was the intervention itself like. What is it that you had to do? Do you have to sit in pretzel poses?
No. It was a very nice experience in reality. And you say mind, body, and spirit, and in my opinion, it's body, mind, and spirit, because you took care of the body first.
Yes.
And so when you said that, I just smiled, only because it really is the body first, and getting the body in balance, and making that comfortable for the person, and it's been a remarkable change in my wife. It is just it's been a joy. Everything that when we were dating is back. When we first got here, it wasn't we were dating anymore. It was difficult. It was and life is never easy.
Yes.
But it just made it so much fun. Ginny's back to the person that I fell in love with, 38 years ago.
I'm so happy to hear that.
Which is really nice.
Yeah, I'm really, really happy to hear that. Yeah, because, and yes, you're absolutely right. I mean, when people work with me, I do emphasize that the body has to heal first, because the aspects of the mind, whether it is controlling your or regulating your emotions, or breathing, or taking a pause before responding to a triggering situation. All of that can only happen when inflammation is down, we are detoxed, and our nutrient needs are taken care of. So thank you for reminding that.
No,
Yes.
absolutely. And that really was knowing what I went through and knowing what I was going through. And now where we're at are just, it's been an incredible journey. It really has been. And you were dead on every aspect that you had talked about. And I'll be honest, there was some skepticism on my side, and that's only fairness for me to say.
Yes.
And it's gone. It's gone. It was never a large skepticism, but it was nice to see improvements. And when you see those improvements, you just feel so much better. And to be where we are now is just remarkable. It's just incredible. It really is.
Yeah. And the point I want to make to everyone listening here is that this is not rocket science. The intervention has been really to clean up your diet,
Yes.
remove inflammation. We used herbs, supplements, and body therapies.
Yes.
And really getting back to the basics of what it is to be healthy in mind and in body.
Yes.
And connecting with one another, connecting with your own self.
Yes.
Very, very simple concepts, but in the business of living in today's world, we forget about the things that actually bring us joy and fulfillment and purpose in life. And but yeah, I am so grateful that both of you have been, and your wife especially, and she was also struggling with some cognitive dysfunction. I can't even say, but the most recent test tells us that there is no more cognitive decline. And how soon were you able to see the positive changes once you started incorporating?
I would say weeks. I would say there were weeks in there. I mean, it is a 6-month program, but you could see small steps along the way. And I think it was a very positive journey. And when you see those small steps, I was rock bottom, and you see those steps and you start climbing, it's nice.
Yeah.
It's very nice.
Yeah. You start by taking small steps, and
Yes.
then it's a canter, and then you're running and galloping.
Yes.
Yes. Yeah. And I see this with everyone, irrespective of what the diagnosis that they came up with, irrespective of how many organ systems are dysfunctional. Really, where there's a will, there is a way. And my job has been for many people, is really been to, one, to remove fear. Because, when you come from, and I was like that, I practiced regular psychiatry and medicine for many years,
Yeah.
and I had to unlearn. And I had to see that disease is just a temporary state. It's a state of uneasiness, dis-ease. And it's a recipe that brings us to that state. And we have to unravel that recipe and put together a recipe for health and wholeness. And that's what we've done. And yeah, it doesn't take long. And the beauty of this work, especially working with your wife and with you, has been that age is no bar.
Right.
All of these are just limitations that we come up with. Oh, I'm too old, or I'm too sick, or my disease has been going on for so long, I'm not curable. No, it's not. All of those are just our self-limiting beliefs, is what I would like to say. Well, thank you so much. And now, in closing, what is the current state of health with your wife?
Well, I'd like to say then I can go back to the mind, because I think her body's in good shape. I think she's dropped some weight, and which she feels good about. I was okay. She's not a super heavy person in any means, but she's dropped some weight, which makes her feel better. And then her mind has just been so much better, able to laugh at herself, able to create jokes. It's just been a wonderful, wonderful experience.
And so you are not walking on eggshells around her.
No, and I was when I walked in here.
Yeah.
As you remember.
Yes.
It was just, no matter what I said, it was not a good thing. And now we can have the funnest conversations, and we can laugh at her, and we can laugh at me, and we can laugh at things that we do together, and it just makes it so much nicer.
Yeah. And now also she's not on any inhalers, she's not on Flonase.
No, absolutely, off of everything, which, I mean, I have stacks of Allegra boxes that I can't get rid of, but you know what? I don't care. I'll be happy to throw those away.
Doctors Without Borders, I think, all of these organizations, they will gladly take your unused medications because, Stay the Path, which is, and today being one of the last sessions, we went over the supplements, so she's not going to be needing many of the supplements either.
Right.
It is really about the basics, which is good food, movement, rest, relaxation, relationships, and fun.
Yes.
Right? It really comes down to just that.
Yes, absolutely.
Thank you very much. Any parting words that you may have?
Thank you for everything you do.
Thank you.